My name is Sima Laeq. I'm a medical doctor in University Hospitals of Birmingham. I'm going to be presenting a quality improvement project about using AI while clerking patients when they first initially come to the hospital. It was done by a group of 5 doctors, and the project was done in the matter of 2-month duration. We've done the project in Heartlands Hospital, which is part of University Hospitals of Birmingham. So as the background, medical clerking is mainly like documentation in the UK, if anyone knows this system. So we have to document when we see the patient, document like the history, examination, and like the hour plan and everything. And at the end, we have to come up with a discharge letter once the patient is being discharged. To reduce the workload, we've used AI for clerking specifically, which can sometimes be like documentation can be taking a lot of time, like when seeing the patient. And it's going to be like the assessment time becomes faster when you use AI based on the result that I will be sharing with you in a bit. And it's obviously going to affect the workflow and like the efficiency of how we like see the patients and like how quick it's going to be. So the objectives are like initially we evaluated to how was like the impact of using AI while clerking the patients. And then we've assessed the effect on the documentation time. Those are the data, like the information we've got when we have focused while we've taken the data. And then we've compared it, like using AI, how long it's going to take seeing a patient using AI versus like the traditional way of just documentation. And then we've identified it and like tried to like specify the barriers and then work on it. So it was a group of 8 doctors, and it was done within 27 shifts of clerking patients. And we've seen 161 patients in total. So the doctors included in the analysis were 5 doctors, as I initially mentioned. So the volume of the patient, as you can see, these are the patients that were clerked in the traditional way, not using AI, just documenting. And these were the patients that were seen during 27 shifts using AI. So we've seen 100 patients using AI in the same span of matter when we compared our results to the doctors who were not using AI during the same shift, who were seeing roughly like less, like about 50% less patients compared to the AI. And then these are the percentage showing the time distribution per patient. So you can see like the blue line is indicating AI and the orange line is non-AI. So these are based on each doctor's data that we've collected. It's showing that not using AI is a lot more time consuming when compared to using AI, which could be like between 5 to 10 minutes. And then without using AI, it could reach up to more than 20 minutes. So these are like each individual 5 doctors' data. The blue ones are indicating AI and the orange ones are non-AI, the traditional methods. And you can see like they've taken a lot of more time when they've used AI. The same doctor has used AI versus not using AI when seeing a patient. So overall time impact, like the traditional way of clerking patients takes about 50 to 30 minutes per patient. And that avoids like sometimes when you're documenting and focusing on the computer, you just don't make eye contact with the patient and you can miss some important information sometimes. However, when we've used AI, majority of the doctors show a lot of improvement, and like the time frame is reduced to about 5 to 15 minutes per patient, which is quite a lot of like improvement. And like that saves about 7 to 14 minutes per patient when we come to like the data. So the doctors who were using AI while clerking the patients were more efficient and they were seeing more patients in the same shift. And as you might be all aware that the NHS has a lot of demand and like it's quite busy, and with documentation the workload increases. However, with AI we were able to like reduce the time and the workload as well. So it controls for like workload and staffing differences as well, and it supports real world operation efficiency. At the end of our data collection, we were sending out some like feedback and surveys to our consultants at the end, and we were getting their satisfaction about how we were performing while we were using AI. And you can all see like they were quite happy about the performance of the doctors who were using AI compared to the ones like, because they were more efficient and seeing more patients. Like almost double of the patients were seen using AI, whereas compared to the non-AI ones. So the workload in UK is like the patient arrives into EFSTM, which is like a front door same-day emergency clinic, and then the doctor performs history examination, and then AI, while doing like from the first minute, the AI generates like documentation. For this project, I forgot to mention that we were using AccuRx application. There are different applications AI, so you just speaking with the patient and it dictates like and documents, transcripts what you're saying. And then so AI generates the structured clerking notes, and you can give them instruction, and then it comes up with like a nice clear documentation, and you can give instruction anytime to make any like change or adjustments. The doctor reviews the documentation at the end, edits, and then everything is ready. The limitation in our quality improvement project was the sample size was quite small and the duration was quite like short, I would say. If we could have done it over a longer period of time, we could have had like better outcomes as well. So the key findings were the AI were quite helpful in reducing the clerking time by approximately 50 to 65% based on the data that I shared as well. The documentation shifted from more than 20 minutes in the the normal clerking method to less than 15 minutes. And then the amount of patients that were seen were quite increased by 73 patients, and the clinicians, the consultants were quite happy about the results. Yeah, so that's about my project. Thank you very much for listening. And if you have any questions, please do not hesitate to send me an email, or I'm happy to if you have any questions at the moment.